Governor Ducey wants to make sure hospitals are fully equipped in the fight against coronavirus.
Yeah, part of the strategy involves keeping COVID patients out of the hospital in the first place. Fox 10's Irene Snyder live for us tonight with more on this. Irene.
Well, Christina and John, good evening. Many hospitals have reported being short-staffed, especially in the last couple of months. Governor Ducey, as you mentioned, trying to help with these issues. He's going to be helping to allot funds to help these hospitals. But in order to qualify, the hospitals are going to have to offer antibody treatments as well as vaccines. As Delta COVID-19 cases continue to surge across the country and here in Arizona, Governor Ducey is allotting an additional $60 million from federal virus relief funds to help hire 750 contract nurses. In order to get the money, hospitals need to offer vaccinations to patients when they're discharged and monoclonal antibody treatments.
Monoclonal antibodies is a tool that's been available, during the pandemic, actually for some time around that, and has been available for patient populations that have been tested positive and are at risk to develop complications from COVID-19 disease, and is something that we've utilized, here in the pandemic. And is certainly a tool that we continue to utilize.
Monoclonal antibodies help by blocking the virus's attachment and entry into human cells. Chief Clinical Officer for Valleywise Health, Dr. Michael White, says these antibodies will prevent the virus from severely affecting a patient, thereby lowering the rate of hospitalizations.
To be able to help, prevent that, again, that severe hospitalization and illness in those folks that we are concerned would have severe complications from COVID-19 disease.
While COVID-19 hospitalizations are not as high as they were earlier on in the pandemic, Dr. White says in many cases, hospitals are still severely short-staffed.
Having the ability to have extra resources that be made available will certainly help us begin to, alleviate some of the staffing shortage.
And as far as that antibody treatment we mentioned earlier is concerned, doctors say that it's been offered at several Valley hospitals since last year, and since then has been helping many of these patients, prevent them anyway, from getting severe COVID-19 cases. Reporting live in Phoenix, I'm Irene Snyder for Fox 10 News.